Hi everybody, I'm Dr. Frost with DoodleVet, and today we're going to do a heartworm test. What do we need to do this? Well, we need the test, which is this little thing and this little thing. We need a way of getting our blood sample, and then of course, we need a whole bunch of treats, which we talked about yesterday. So let's get set up for our blood collection. Okay, Abby is sitting here comfortably in her favorite chair. We're just going to kind of size up the situation. We're going to use her right arm. Now, she hasn't been groomed since I don't know when, and her fur is long, and the lighting isn't that great. So I've got a headlight on and some magnification as well, because I want to hit these veins on the first try. I don't want to be poking around. We all have been there where we're getting jabbed at the clinic or whatever. We don't like it. Dogs don't like it either. So we threw the tourniquet on, a little bit of alcohol to kind of mat down the fur, veins kind of plumped out. This is where I start showing her the syringe, kind of poking her in her arm with the cap on and giving her a treat. And we're going to do this a whole bunch of times so that she associates getting kind of poked in her arm with a treat. And so we did this, I don't know how many times, but a whole bunch. And then after she's kind of accustomed to the routine and everything, and after we feel like we have a pretty good line on that, then we're going to pull the cap off and grab the blood sample for real. And one of the nice things about these heartworm tests is they only require 40 microliters of blood. So I'm using a 29 gauge insulin syringe, and these needles are pretty small. Most dogs really don't mind them too much, and there's the treat. So we got our blood sample, she got her reward, she's comfortable, she's not restrained. This was how we really like to do it. When it comes to running the test, pull it out of its little package here. Now, 40 microliters off of a 29 gauge needle works out to 3 little drops of blood. So that is the volume of blood we're going to put in the little test well. So just pull that cap off there and then put our 3 tiny drops, 40 microliters. And then after the sample is put in the well, then we put a diluent in there. And this is 4 drops out of the little white bottle here. So we'll just zip the cap off there, put our 4 drops in, and then this test just sits there, and we read the results between 5 and 10 minutes after it started. So it's been 5 minutes. Let's read our test. We have 2 lines that can potentially come up. One is the control line, which we want to see, which we do. The other one's the test line, which we do not see. So this is a negative test. She does not have heartworm disease. Awesome. And that's how we do it. Now on Facebook, we're at DoodleVet LLC. And if you have any questions, just message me there and I'll get right back to you. If you happen to need a heartworm test, you can book one straight from our website at doodlevet.com. Thanks.